afternoon. My name is Angela, and I'm here to perform catheter care. Good afternoon. My name is Angela, and I'm here to perform catheter care. Give me 1 minute. Let me wash my hands, and I'll be right back. As always, with every skill, I provide privacy. I literally have to close the door and provide privacy. Provide privacy. Always wash my hands at the start of every skill and gather my equipment. This case, my equipment is a container to wash basin, 2 washcloths, 2 bath towels, gloves, and soap. I go over to the sink and I catch the water. Real warm water. I feel the water. Then I take the water over to the patient and I have the patient feel the water. Mr. Jones, can you please feel the water? Mrs. Jones says the water feels comfortable. Then I'm going to place my gloves on. Mrs. Jones, how are you doing today? Good. At the start of every skill, I always make sure the bed wheels are locked, and I always bring the bed up to my working level. And then I will expose the area only that I'm going to work. I have already provided privacy. So with my gloved hands, I'm going to have Mrs. Jones roll over just a tad bit so I can place a barrier under her buttocks. Mrs. Jones, please roll over so I can place the barrier under your buttocks. Thank you. And then I'm going to place both of my towels in the water. I'm going to get 1 towel and I'm going to put soap on the towel. I'm going to make it nice and soapy because I'm going to wash the catheter. Very importantly, I'm going to hold the catheter at the urinary meatus while washing the catheter 4 inches down. And then I'm going to change the space on the towel and wash another time, making sure I'm not tugging at the meatus. And I'm going to change to another location on my wash towel and wash 1 more time while securing the catheter at the urinary meatus. And then I'm going to place that soapy towel on the edge of the wash basin. And then I'm going to rinse. I'm going to rinse the catheter while holding onto the catheter at the urinary meatus without pulling. I'm going to rinse 1 down 4 inches. And then I'm going to change the location on my washcloth and rinse another time. And then 1 more time, changing the location of the washcloth, I'm going to rinse 1 more time. Then I'm going to place this wash towel on the edge of the wash basin. Then I'm going to get ready to dry the catheter while holding at the urinary meatus without tugging. I'm going to dry 1, and then I'm going to change locations on my towel and dry 1 more time, 4 inches down, while holding onto the catheter at the urinary meatus. So after I'm finished with the drying, I'm going to release the catheter, and then I'm going to place this one here, the large towel, and then I'm going to have the patient roll over, please, so I can remove the towel from under. And then I'm going to cover the patient. And then I'm going to take my towels without soiling myself, or without these towels going onto my clothing, and I'm going to put them into the soil hamper container. With my gloved hands, I'm going to take the basin and go over to the sink, empty, rinse, rinse, dry, and I'm going to place my basin in the designated area. I'm going to take my gloves off, glove to glove, skin to skin. I'm going to place the gloves into the soil container, wash my hands. Then I'm going to come back over to the client. I'm going to take the soap, place it where it belongs, and then I'm going to make sure that the patient is tidy. And I'm going to return to him his signaling device, and I'll say, please call me if you need to. I'm going to place the bed back down into its lowest position. Thank you very much. I'm through with that skill.